Hello, we are Clinical Group J, and we are presenting on public health in Genesee County. Genesee County has a below-average household income and has declined 0.16% from the previous year. The poverty rate for the county is pretty high at 20.2%, which is roughly 82,000 people. It includes cities such as Flint, Burton, Mount Morris, Montrose, Grand Blanc, Flushing, Goodrich, Davison, Swartz Creek, Otisville, Clio, Linden, and Fenton. This is footage from a windshield survey that we did in Flint around Catholic charities. There is a lot of open area that is unused, boarded up doors and windows of homes and businesses, poor quality roads, trash littered among the streets, and liquor and convenience stores on many of the street corners.
While Genesee County is a very diverse area, some areas are more diverse than others. For this diversity section, we compared one of the most diverse areas, Flint, to one of the least diverse, Grand Blanc. This is an age distribution chart for the county as a whole, Grand Blanc, and also Flint. Flint has an overall younger population with a smaller geriatric population. Grand Blanc is slightly more female concentrated compared to Flint and the county as a whole. Grand Blanc has the highest level of college graduates in Genesee County at 44.9% of the population holding at least a bachelor's degree, and 95.7% graduating with a high school diploma. Flint's high school graduation rate is at 84% and only 8.9% of people holding at least a bachelor's degree. Genesee County as a whole is predominantly white, and even more so in Grand Blanc. In Flint, 53.9% of the population is black compared to Grand Blanc's 11.4%. The three most common races in all of Genesee County and its cities are white, black, and Hispanic. Grand Blanc's median household income is double that of the household incomes of families in Flint and is still significantly lower than the median household income in Genesee County. Uninsured rate is still higher in both Flint and Grand Blanc than it is for the county as a whole. The poverty rate of Flint is nearly 3.5 times the poverty rate in Grand Blanc. State poverty rate for Michigan is 14.2%, so Genesee County as a whole is more impoverished than Michigan in general. National unemployment rate has been holding steady at about 4%. Michigan's unemployment rate has been about 4.5%, with Genesee County's unemployment rate sitting at 6.1%.
The most recent data from the Association of Religion Data Archives is from 2010. This data discovered that the majority of individuals, approximately 61%, had unclaimed religious affiliation. The next largest group drops drastically down to 14% of the population, representing evangelical, and then roughly 11% of Genesee County are Catholic. Other religions in this area include Black Protestant, Mainline Protestant, Orthodox, and an other category.
Genesee County has a tremendously vulnerable population. Looking at the vulnerability model used in class, the behavioral and sociocultural domains are our focus for this section. The behavioral domain: individuals in this community are less likely to use safe sex practices and more likely to participate in substance abuse, needle sharing, and risky behavior due to their vulnerability. In the sociocultural domain, economic status deeply affects the community, making them vulnerable. Because the poverty rate is significantly higher in this area than most, these individuals are at a disadvantage when it comes to their health status. The lower high school graduation rate than the surrounding counties makes them vulnerable as well. Catholic Charities provides resources for individuals in need with daily care supplies such as shampoo, soap, toilet paper, feminine hygiene products, baby formula, etc. This facility also offers laundry services, showers, group therapy, a soup kitchen, and a warming center. Flint Cultural Center's goal is expanding educational opportunities for children and youth throughout Genesee County and contributing to the region's economic vitality. YMCA works to ensure that everyone, regardless of ability, age, cultural background, ethnicity, faith, gender identity, ideology, income, national origin, race, or sexual orientation, has the opportunity to reach their full potential with dignity. There are 4 YMCAs in Genesee County that have programs that focus on youth development, healthy living, and social responsibility for youth.
Here I have listed health issues throughout the lifespan for adolescents and young adults, childbearing age, and post-childbearing age. These vary based on sex education, STI prevention, screenings, different changes such as menopause and erectile dysfunction. According to a news report in 2012, teens in Genesee County experienced the highest incidence of teen pregnancy and STIs. Recent data in 2017 shows that there was a total of 3,826 cases of STIs in the county. Stevie Atkins, Chief Executive Officer of Wellness AIDS Services, addresses school education on sexual health as a major influencing factor. Something this county considered was teaching puberty education in students as young as 4th graders to educate on hygiene and basics of how their body works. However, they learned that some students began having sex in 4th grade, therefore starting sex education in even 5th grade may be too late for some kids. The county hopes to implement sex education in an age-appropriate manner to help decrease this incidence rates. A specific case to discuss when it comes to Genesee County is effects that lead from the Flint water system has on fertility and birth outcomes. A study conducted in 2017 found that overall fertility rates decreased by 12%, fetal death rates increased by 58%, and overall health at birth decreased. It further discusses the implications this has on a community, such as affecting school funding and health expenditures. This study also points out that lead builds up in the body over time, so analyzing only neonatal outcomes in this study may underestimate the overall effects of lead on human and health development. Further statistics gathered in the diagrams to the right show common causes of pregnancy-related death in Michigan overall. The diagram below it found that 44% of cases could be prevented. As listed in the previous slide, some ways of prevention include screening for certain conditions in pregnancy that may help decrease the amount of pregnancy-related deaths if we can diagnose and help manage through educational resources in the community. Another statistic for Genesee County found that in 2017 there were 37 infant deaths. Both links provided in the slide are educational and informational resources for education of sexuality and STD, HIV, in schools, as well as the Pregnancy Risk Assessment Monitoring System for Michigan, which shows the prevalence of maternal and child health indicators. Resources within the Genesee County community include, but are not limited to, the facilities and organizations listed in this slide. Most resources, such as Maternal Outreach of Michigan, Carriagetown Ministries, and so forth, help by providing clothing items, formula, diapers, and furniture. Other resources, such as the Genesee County Health Department, Hamilton Community Health Network, Genesee Health Plan, McLaren, and Planned Parenthood, are healthcare facilities that offer testing, screening, education, and resources.
In Genesee County, some risk factors for growth and development include drug and alcohol abuse, water quality, the mother's diet, and environmental pollutants. There are a few community resources for pregnant women especially, including Flint Crisis Pregnancy Services, Genesee County Health Department, Flint Eastside Mission, Answer Center for Women, and more. These resources provide things like pap smears, pregnancy screening, prenatal vitamins for free, and more. The 3 most common types of violence committed in Genesee County are aggravated assault, theft and larceny, and burglary. These alone are nearly 300% above the national average of violent crime acts that are committed yearly. Many times, these crimes are committed due to socioeconomic status related to these individuals. Areas in Genesee County, like Flint, have a lot of impoverished citizens living there. When people experience poverty, it can sometimes influence decision-making in order to reach the lowest level on Maslow's hierarchy of needs.
Like violence, disaster can have a negative impact on the community that's involved. Disaster is a sudden, calamitous event that seriously disrupts the functioning of a community or society and causes human, material, and economic or environmental losses that exceed the community's or society's ability to cope using its own resources. This can be either from natural or man-made causes. Examples include floods, earthquakes, hurricanes, drought or water shortages, communicable disease epidemics, and tornadoes. Once again, this can be detrimental to both short and long-term effects on the community in regards to an altercation in residency. Once again, this can be detrimental both short and long term to the affected community in regards to an alteration in residency or transportation status, emotional distress, and financial hardship. An example of a disaster in the Genesee County area is the Flint water crisis, in which there was a contamination of the water supply. A toxic cocktail includes lead poisoning of the water, present Legionella, and EPA in action. EPA in action is the delayed response of the Environmental Protection Agency to react to this knowledge of poisoned water. They are the ones responsible for setting and enforcing rules and standards to protect the environment and control pollution. They were not swift in taking corrective actions to rectify the situation. Legionella causes Legionnaire's disease, which is a type of pneumonia. 87 people were sickened and 12 were killed as a result within the Flint community. The Flint Registry is for the residents, workers, children, and daycare students of Flint who are affected by the contaminated water. Counseling services available received the grant since it was a recognized disaster, and lead present in the water caused not only physical but also psychological damages.
Genesee County has organizations that provide low-cost or free resources for the uninsured to utilize. Key resource centers for the area are the Greater Flint Health Coalition, the Genesee County Health Department, Flint Cares Community Help Centers, and Genesee Health Plan. Some of the services included are dental care, family planning, outpatient mental health, immunizations, and communicable disease care, along with access to personal care items, lead-fighting products, and nutritious foods. Eligibility for the resources depends on the specific service requested, but usually comes down to living in Genesee County, meeting the income requirements, having no insurance, and those who have been affected by the Flint water crisis.
Our first nursing diagnosis for the Genesee County area is risk for poor health outcomes over the life course of adolescence related to high poverty rates of 20.2% and environmental influences. We have many interventions for this first diagnosis, but some of our interventions that we highlighted are self-care assistance, providing showers, laundry services, and personal hygiene products, and implementing puberty sex education at a young age for free within schools. Our second diagnosis is low educational attainment related to socioeconomic and transportation issues, as evidenced by roughly 28% of individuals without a GED, high school diploma, or higher. Some interventions for this diagnosis could include implementing more GED programs at a low cost and promoting high school college achievement at a young age by inviting motivational speakers such as doctors and firefighters to speak to young students. Our last diagnosis is difficulty accessing community resources related to lack of transportation, as evidenced by decreased socioeconomic status in Genesee County. Our interventions for this diagnosis include implementing better transportation systems that are low to no cost for the general public and providing these resources close to the low-income housing environments. And these are our references for this presentation. Thank you.